Let me ask you something most men never hear from a doctor. What if 1 minute a day could restore circulation, ease pelvic tension, and bring back energy you thought was gone with age? It sounds unlikely, maybe even awkward, but it is real. Modern physiology and clinical observations line up with traditional manual therapies to show that targeted stimulation of a small point in the pelvic network can change flow and nerve responsiveness. I am Dr. Alex James, clinician and movement specialist with 20 years working with men over 45 who want practical, natural ways to recover function without drugs or invasive procedures. Listen, because what I will show you is simple, safe, and built on physiology you can feel in your own body. Many men I follow notice fewer nighttime bathroom trips, clearer morning energy, and less nagging pelvic discomfort after a few weeks of a daily 1-minute routine. There are no pills, no machines, just a targeted manual gesture that signals your body to relax, open vessels, and restore oxygenation. Before we go further, if you want solutions rooted in evidence and common sense, hit like and drop in the comments where you are watching from so this community grows and we can learn from each other. Stay with me and I will show you the exact location of the point, explain why it works in terms you can trust, and guide you step by step so you can start today and feel the change in weeks rather than months. Now let us unpack why this issue arises and what is truly blocking you. For decades, many men have been told the same few phrases about aging: lose testosterone, accept decline. That misses the point. The core problem for a large proportion of men is mechanical tension and compromised microcirculation in the pelvic region. Imagine a garden hose left kinked for years. The water is still in the hose, but it does not reach the plants. Long days sitting at a desk, repetitive strain, subtle postural shifts, untreated low-grade inflammation, and stress create a chronic pattern where pelvic muscles tighten like a knot in that hose. Vessels become compressed, nitric oxide signaling that normally dilates small arteries is reduced, and nerves that carry sensation and control become less responsive. You may feel it as more trips to the bathroom, less morning firmness, less stamina, or that dull ache across the lower back and pelvis. Many treatments focus on hormones or quick fixes because those are easy to sell, but they do not address the mechanical choke point. Reversing this starts with restoring flow and releasing tension. The analogy is simple and practical, like unkinking a hose, then washing it out so water runs freely again. There are habits that feed the problem, including prolonged sitting, shallow chest breathing, heavy caffeine late in the day, and avoiding light daily movement. These are easy to name and much harder to change without a stepwise plan. Now that we understand the real cause, imagine reversing the process by teaching the body to relax that knot. There is a small point between layers of pelvic muscle and connective tissue that acts like a valve in this network. Stimulating that point with gentle pressure for 60 seconds can encourage local vasodilation, increase nitric oxide-mediated flow, and reduce neural irritability. This is not magic. It is physiology combined with attention and consistency. Anatomically, the point sits superficially to a central tendon and aligns with branches of the pudendal nerve and small perforating arteries. When those structures are gently stimulated, local blood flow increases, surrounding muscle tone decreases, and the brain receives a different sensory message, one that says relax rather than brace. Studies on nitric oxide and manual therapy show improved perfusion after targeted stimulation, and clinical practice from pelvic health therapists complements these findings. You will not need a microscope to find it, but you will need clear, careful instruction so you apply the right pressure and cadence. Before I show you exactly how to do it, I want to share a brief pause. I know trying something new in this area can be awkward. Many men feel embarrassed or skeptical. It is normal. But before you decide, tell me one word in the comments right now. Try, later, or never. One word. Your reply helps others see this is not just them, and it takes a second. Thank you. Now, here is the exact how-to, step-by-step, with sensory cues who you perform it safely and effectively. Start by finding a quiet place where you will not be hurried, a bathroom or bedroom with soft light, and a comfortable surface. Lie on your back with knees bent and feet flat, or sit on a firm chair with both feet planted. The point I want you to find is located a little above the perineal midline, roughly at the junction where the deep pelvic floor rises toward the pubic bone, not inside any body cavity and not at the genital tip. Use your index and middle finger together with a small amount of natural oil, such as sweet almond or fractionated coconut, so your fingers glide smoothly across skin. Press gently into the tissue with enough pressure to feel a connective resistance but not pain. You should feel a mild warmth and a soft give, like pressing into a ripe peach but stopping before it yields. Breathe slowly as you apply pressure. Inhale 2 seconds, hold 1 second, exhale 4 to 6 seconds. Maintain steady pressure for 60 seconds while you count breaths. If you experience a sharp pain, back off immediately. The rhythm matters more than brute force. Think of tapping a key on a piano gently and repeatedly rather than pounding a drum. Many men notice the first time a subtle spreading warmth or a faint tingling across the lower belly and inner thighs, which is a good sign the circulation is responding. Repeat this technique once daily for 3 weeks. If you prefer, do it right after a warm shower when tissues are more pliable. Use light lubrication if you experience friction. Here is a short guided dialogue I often have with patients while I teach them, so you can hear the tone and questions that usually come up and how we answer them. Patient voice: Mark, I am nervous about touching here. How will I know I am doing it right? Dr. Alex: start gently. Use oil and aim for a sensation like pressure but not pain. Mark: I tried and felt nothing. Is it supposed to be immediate? Dr. Alex: not always. Some feel a change the first time, others need consistent days. Focus on the breathing and the feeling under your finger rather than the expectation. What if I accidentally press too hard? Stop and loosen pressure. It is better to understimulate than overdo it on the first attempts. Mark: can I do this if I take blood thinners? Dr. Alex: check with your physician first, but often gentle pressure is safe. Mark: how long until I notice anything? Dr. Alex: many men report small changes in 2 to 3 weeks, more marked results by 6 weeks when combined with movement and breathing work. What else should I do at home? Daily short walks and diaphragmatic breathing amplify the response. This exchange illustrates how normal questions are and how we calibrate intensity and expectations. While you practice the 1-minute routine, add 2 simple habits that multiply the benefit. First, walk for 10 to 20 minutes after your main meal. Light movement improves blood flow, supports digestion, reduces stagnation, and helps the pelvic tissues to respond more readily. Second, practice diaphragmatic breathing 3 times per day for 5 minutes each. Sit upright, place one hand on your chest and one on your belly. Inhale slowly, so the belly rises first and the chest follows, then exhale fully. This pattern increases oxygenation, supports nitric oxide signaling, and reduces chronic sympathetic arousal that tightens pelvic muscles. Together, the massage point, walking, and breathing form a compact routine you can maintain. Now, let me tell you about real men who use this approach so you can see the human side and the range of responses. These are composite but grounded in clinical encounters and named to give a sense of lived experience. Thomas is 52, software engineer who came in complaining of frequent nocturia and low energy. He had been sitting 12 hours most days. The first week, he reported mild warmth when applying the technique and less restlessness at night. 3 weeks in, he slept longer stretches and reduced caffeine, which helped further. Henry is 61, retired carpenter who felt shame and avoided conversation. He tried the practice with steady breathing and noticed a reduction in pelvic ache after 2 weeks. By 8 weeks, he reported improved confidence and fewer interruptions during sleep. Lewis is 49, gym owner who was skeptical about natural approaches. He practiced the 1-minute routine after showering and added short walks. Within a month, his morning firmness and endurance were noticeably better, and he described the change as unexpected but welcome. Robert is 58, office manager, who had tried pills and felt temporary effects. He combined the routine with pelvic floor stretching and noticed more lasting improvements, less dependence on quick fixes, and a regained sense of agency. Sam is 65, widower, who found the ritual comforting as well as effective, reporting enhanced mood and a return to evening walks with friends. These stories show variety in starting points, pace of change, and benefits. They also highlight a theme we see repeatedly: consistency trumps intensity. Now, I want to address critical moments of tension that commonly arise and how to navigate them. The first moment of tension is the initial skepticism and embarrassment many men feel attempting an intimate practice on their own. It is common to freeze, to imagine judgment, to stop before giving the body a chance. This tension is not failure. It is human. The practical fix is small steps. Begin with 5 seconds of gentle contact, then extend gradually. Use a mirror or a guided audio, and remind yourself this is about function, not performance. The second moment of tension is when progress stalls after a few weeks and discouragement threatens to stop practice. The body reforms patterns slowly. At this stage, measure small wins, such as fewer bathroom trips or gentler pelvic sensations, not a binary cure. Keep a brief log and celebrate the small changes. The third moment of tension is when men compare themselves to younger norms and revert to pills or quick interventions that mask rather than rehabilitate. Remember that medication can be part of a plan, but often hides the underlying mechanical patterns. Combining a daily manual routine with lifestyle adjustments reduces reliance on pharmaceuticals and strengthens long-term resilience. Each of these moments deserves empathy and clear steps to proceed. Now, let us contrast why many medications fail to deliver lasting results and why this manual approach offers a real advantage. Drugs that increase blood flow work by altering systemic hemodynamics and can provide short-term improvements, but often come with side effects and a reliance that does not teach tissues to self-regulate. Pills can be powerful emergency tools, yet they do not address tight fascia, compressed vessels, or dysfunctional breathing habits. By stimulating the local point and practicing consistent movement and breath, you re-educate both peripheral tissues and central nervous system pathways so the body regains its capacity to open vessels and regulate tone naturally. This is why the approach is durable. It is a reconditioning process rather than a temporary override. To make this part of your life, add small complementary habits that fit your routine. Stand up and walk for 2 minutes every hour if you work seated. Do a 1-minute diaphragmatic breathing session after lunch and another before bed. Bedtime screens should dim, and caffeine should stop 6 hours before sleep to support restorative cycles. If you have a cold bath habit, you can time the 1-minute massage after a short warm shower to increase tissue pliability. These micro habits create a context where the 1-minute gesture can produce ripples of change. At this point, I want to invite you to a 3-week challenge that is practical and measurable. For 21 days, perform the 1-minute pelvic point massage once per day with the breathing pattern I taught. Walk 10 to 20 minutes after a main meal at least 5 days a week, and do diaphragmatic breathing sessions 3 times daily. Keep a simple journal, noting nightly bathroom trips and morning energy scores from 1 to 10. Share a 1-word update in the comments each week to help keep others accountable and to build community. If you want a structured audio guide for the 60 seconds and the breathing, I will link resources below. Now, a condensed epilogue framing what consistent practice looks like across time and what you can reasonably expect. After 1 week, many men notice subtle sensations, warmth, or a slight decline in urgency. After 3 weeks, patterns start to shift. You begin sleeping in longer blocks and waking with a little more clarity. At 1 month, the nervous system pairing between sensation and relaxation strengthens, and you will likely notice reduced pelvic ache and improved confidence. At 3 months, changes consolidate. You need fewer quick fixes, and your daily routine supports sustained vitality. At 6 months, your body remembers how to maintain better tone and flow, and many men describe a reclaiming of energy and a reduction in embarrassment. This progression assumes consistency and the addition of simple movement and breathing. Please understand this is not a promise of a specific clinical outcome for every individual. It is an invitation to choose a low-risk, evidence-informed path that has helped many. Finally, a brief medical disclaimer and closing call to action. This guidance is educational and not a replacement for individualized medical advice. If you have active bleeding, uncontrolled anticoagulation, recent pelvic surgery, an implanted device in the pelvic area, or significant cardiovascular disease, consult your physician before starting. If you take blood thinners or have concerns, check in with your provider. If you feel severe pain at any time, stop and seek professional evaluation. If you found value in this short practice, subscribe to follow a sequence of guided routines, like this video to support the channel, and comment "Ready" if you will try the 3-week challenge. Share where you are watching from and one-word progress updates so other men know they are not alone. Remember that your body remembers how to thrive and often needs only a clear signal and daily reminder to rebuild circulation and ease tension. Give it 60 seconds and a little consistency, and you may be surprised by what returns.